So to continue, another type of medication is the inotropes. These strengthen the heart's ability to pump. I don't have a lot of information on those, but another type is the prostaglandin E1, which looks like this chemical structure. It keeps the ductus arteriosus open until surgery for patients who have so it creates a patent ductus arteriosus. What it does is it improves blood flow and oxygen levels and is useful if other parts of your heart is blocked or deformed. So keeping this duct open at least gives your body some blood instead of none. Other types of treatment. Most likely have to take medications after surgery. So some meds are the antiarrhythmics, which ensure a regular heartbeat and it slows down the electrical impulses in the heart. There are two types, the calcium channel blockers. So these are like the digoxin, diltiazem, verapamil, or beta blockers, or the potassium channel blockers, which are the sotalol, dofetilide, amiodarone. Another type is the ACE inhibitors. They relax the arteries and decrease resistance to blood flow. The digoxins, they increase the strength of the heart's contractions, so it makes your heart pump stronger. And diuretics, they decrease the amount of fluid in circulation, which reduces the volume of the blood to be pumped, so your heart doesn't have to work as hard. Also important is after the first 6 months after surgery, you'll need to take antibiotics if you want to do any dental work to prevent infection of the heart, which is called endocarditis. There's also some non-surgical procedures. So an example is cardiac catheterization, as I mentioned before. This can repair simple holes in the heart. They use a catheter, which is a thin tube inserted into a blood vessel in the groin or the arm. It's guided to the heart so the surgeon can insert a plug in the hole to repair it. Another method is the percutaneous coronary intervention, or PCI. It's also called the angioplasty with a stent, and it repairs defective cardiac valves, like if they're narrow or too leaky, with a tiny balloon guided to the heart inside a catheter. Another non-surgical procedure is the percutaneous valve implantation, which uses these catheters to put in an artificial valve. And then obviously, another method of treatment is surgery. So you can have a heart transplant. So when your defective heart is replaced by a healthy donor heart using open heart surgery. Also, heart repair. This uses stitches, patches, or plugs to repair the hole or the duct that needs to be fixed in the heart. Like in this picture here, you can see that they're using a patch with stitches to sew up a hole in the heart. Okay, so some fun facts. Congenital heart disease affects about 1% of all newborn babies. So it's not exactly super rare, but it's not common either. The most common heart defects are ventricular septal defects. So those are a hole in the wall between the two ventricles, so the lower chambers. That's the most common defect. And then also, 95% of babies born with a non-critical heart defect are expected to reach the age of 18, and 69% of babies born with a critical heart defect are expected to reach the age of 18. So that's pretty high. So I think that's pretty good that our technology has advanced so far to allow these babies to survive.